Hi, so I'm Summer May Finlay, I'm a Yorta Yorta woman, and we're at the International Indigenous Health and Wellbeing Conference put on by Lowitja, and I'm here with Associate Professor Chelsea Bond, who gave this fantastic presentation, and she says a lot of really good stuff, but I thought we could focus on the Inala Manifesto. Can you tell us a little bit about it?
So the Inala Manifesto was conceived in Inala, hence the Inala Manifesto, and it was coming together of a range of different people, black fellas, white fellas, different kinds of researchers, health professionals who've had the good fortune of working with, who've made me think and informed my own work, to carve out this space that frames much of the work that we're doing in Indigenous health. And it's about how do we carve out this intellectual home for us. And it's a bringing together of Whitney's Indigenous research principles and the work in the health humanities space. So how do you bring the criticality that of critical Indigenous studies together with health humanities and open up who gets to deal with the business of health intellectually? Because as much as we love them, the doctors and the epidemiologists don't have all the answers, and so it's allowing more thinkers into the room. Currently our approach to Indigenous health research is train up health professionals, then make them do PhDs and become health researchers. Which can be a pathway. I was a health worker, became a health researcher, but I do think that that's not a sustainable model. It's taking too long for us to do that. But some of our mob need to be the healers. They need to be on the boards. But we have other thinkers like the political scientist, media studies, the poet, the philosopher. The kind of spaces that are created when we collectively come around the table and think about how do we transform health outcomes, what knowledge is needed to do that. But the Inala Manifesto, it doesn't just deal with knowledge production. It recognises that health is a matter of justice, that it's a political struggle, and returns to what was first articulated in the National Aboriginal Health Strategy in 1989. And so it deals with how do we even affect change through knowledge and do that kind of transformative work. So it means, how do we train up researchers to be public intellectuals? How do we train them up to be able to do that advocacy work? Because we know that's part of the battle. And a lot of us, we go to PhDs in the hope that we'll be in a position to produce the evidence base to affect change.
That's...
But newsflash, nothing in Indigenous affairs is ever informed by the evidence base. Nothing. It is a political struggle. And so we need other weapons to fight that war. And so I want to know from the political scientist, I want to know from the activist, I want to know from the poll, I want to know different ways of knowing how to take up this, actually to win the war.
And what you actually said really resonated with me, because I actually don't have a clinical background, so I started in social science, went and did an MPH, which I see as being really closely aligned. And sometimes I have found that the academic institutions and through research actually minimise those of us that don't have a clinical background. And it was really refreshing to hear that there is genuinely a space for us, and it's not all about clinicians. And quite frankly, we know this. When you think about the definition of health being spiritual, cultural, physical, community, we know that it's not just our physical health, and yet we're still minimised in our roles in that. And I really loved that you were talking about the poets and the activists, because people like that have so much to give and yet often aren't included. There's no space for them, they're not valued. But a statistician is.
Apparently so, and I think if we think about even the type of training we give in public health, is so very limited, because there's a focus on biostats.
Not my favourite.
That hasn't worked for blackfellas in terms of affecting change, and so we need to think about what can we learn from other disciplines to be able to think about health as a transformative space. Not just one where you produce peer-reviewed journal publications and get research grants and just maintain the business of doing research and losing sight of we're here to affect change in health outcomes for our mob.
Absolutely. And I think it's, I know you put yourself out there a lot, and you know that I know...
by choice, I'd have to say.
And you know
in
that
my defence.
And you know that I know that you, at times, someone said to me once, if you're going to stick your head up, you're likely to get shot at. And
every day.
It shouldn't be the way it is. But I want to, as a younger researcher, an emerging researcher, you actually help carve a a path for us.
Oh.
And the work like this that you're doing actually gives us permission to do and say the things that we feel like we should but often don't have the confidence. So while you may be getting shot out by those that probably don't understand, I hope you know that those of us that are learning to understand, because we are valuing you as an Indigenous researcher and the work you do, really value the work you do. At least I do personally. And I can't speak on behalf of all Indigenous people.
And I'm a beneficiary of the labour of watching others, particularly staunch black women, who have and watching them, and for me, my role models are not all in the academy. They're, you know, them sisters, Daranam, Ricky, Tani, Nayuka, these ones that I just go straight from seeing them fellas, you know, and so I just I love that we're all learning from each other. There's not one main actor, not trying to be the one. It's how do we collectively come together, learn from each other, and sharpen our weapons.
Absolutely. And it also validates those elders that went before us that didn't have access to the academic institutions, and yet the wealth of knowledge. I look at my mother, left school at 14, and yet she's the one that I, you know, hope takes away from our work and also guides me in the academic work that I do.
Yep, absolutely.
Yeah, thank you. And I have to say, isn't her top fabulous? And she should wear colours like that more often.
I shall.
Thank you.
Thank you.